Hi, I'm Dr. Facko from Palos Pediatric Dentistry in Palos Heights, and today we're talking about getting your kids to brush their teeth. As a dad of 4 kids, I can tell you we've had a range of experiences and challenges in my own house, as well as everything that I hear every day at the office. So I hope I'm able to provide some insight and value that helps you get your kids brushing their teeth consistently at home. Why might kids resist brushing their teeth? To me, one of the biggest challenges is just motivation. Kids have a hard time understanding long-term consequences or cause and effect over long periods of time. So the younger we are, the more we crave or thrive with immediate feedback, and long-term consequences are just too hard to conceptualize for little kids. So telling your kids, if you don't brush your teeth, you're going to get cavities right now? No, they're not going to get cavities right now. They're going to get cavities in 6 months or in a year or in 2 years, or truthfully, they may never get cavities and just get gum disease as an adult. And for a little kid, that's a really hard way to motivate them. So I think looking at immediate feedback, immediate consequences is much better than thinking about the long-term consequences, which they just aren't going to understand. The other challenge with trying to describe the consequences is some parents will use the dentist and the consequences at the dentist to try to motivate their kids to brush their teeth. So if you don't brush your teeth, you're going to get cavities. And if you get cavities, you're going to have to go to the dentist. And the dentist is big and old and mean, and he's going to do all these things to you, and you go down that road. And the challenge is sometimes kids who brush their teeth still get cavities. And now we've built up this big scary thing that then leads to kids struggling to cope with dental treatment in the office, just in the conventional setting. Obviously, I love to minimize sedation and invasive care just about any cost. And so using the dentist and dental consequences as a threat, to me, comes off as being a little bit counterproductive. Some kids are sensitive to different toothpaste flavors or just the texture of the toothpaste. I think what actually works varies depending on age, but there is one underlying thread with all of them. And for better or worse, this is something I struggle with as a parent, and that's modeling. It's what we do as parents. So it's really hard to tell your kids to brush their teeth for 2 minutes twice a day when neither mom nor dad are brushing their own teeth for 2 minutes twice per day. So one of my challenges personally is I work pretty hard, but I'm not perfect, to try to have healthy habits for 2 reasons for myself. One is I don't want to be a burden on my kids one day when I'm old, or be the least burden possible. But the other is I want my kids to just kind of see an example of healthy behavior and modeling, and hopefully over time they see and they start to follow along. It's the hardest answer, but I think it's also the right answer and the important answer. Regardless of your kid's age, I think that modeling is important. With little kids, it can be exciting to let them pick their own toothbrush and toothpaste. You go to Target, the store, and they get to see it all in person and pick out the character they like or the flavor they like, and just get them involved in the process. Again, little kids, I think brushing together, so you're brushing your teeth and they're brushing their teeth, is an easy way to do it. Using a timer obviously helps to make sure that they do it for the full 2 minutes, and you can make it fun. The world is full of devices, and we deal with all the negative consequences of having all those devices. One of the perks might be putting on their favorite song and brushing for the duration of the song. Overall, I think the important thing with little kids is that a parent is actually doing the brushing every time. So if your kids like to start and feel independent, as long as you circle back and finish up for them and really brush as though you're assuming that they did nothing at all. So you're brushing every area yourself, regardless of how much they participated, is important. And last point with little kids, consistency beats perfection. And so look, when it's late at night or they're tired or they're throwing a tantrum or whatever it might be, doing the brushing and establishing that routine and showing them that it's okay, it doesn't matter how you behave, this is something that we need to do, and we're going to do it every time regardless of how you behave. I think that the consistency over time is far more important than how good of a job we're actually doing. With school-age kids, maybe age 6 to 10, I think just reinforcing it's not something we negotiate. So just like you get dressed in the morning and you take a shower at night, you brush your teeth in the morning and you brush your teeth at night. So it's just kind of something that we do. They might be getting a little bit more independent. In that 6 to 10 range, a 6-year-old still needs help brushing their teeth every time. A 10-year-old might not. But does that mean that the 10-year-old is free to be completely independent? To me, probably not for most 10-year-olds, but that transition, it's a 4-year period, we're transitioning from primarily parent brushing to primarily child brushing, but they're supervised. So the things that we're watching for is the toothbrush has toothpaste on it, it's in the mouth, it's moving, and 2 minutes go by, versus the kids who go in the bathroom and wet the toothbrush and set it back on the counter and walk away and tell you they brushed their teeth. For those kids, I think that supervision is important also as they're getting close to being more independent with brushing. Using a timer, I think, is important. There was a study, I'd have to dig it up, on toothbrush time if left unsupervised. And I think the average time for kids to brush their teeth without supervision was something scary in the range of 15 seconds, which means half of kids brushed faster than that. So I think as they become more independent, the time becomes important. Their concept of time is different than ours. I'll challenge you, if you've never used a timer to brush for 2 minutes, I could all but promise you've never brushed for 2 minutes, because it's a long time. 2 minutes of watching TV or scrolling on your phone goes by in the blink of an eye. 2 minutes of brushing your teeth feels closer to 2 hours. I think if you did that experiment yourself, you'd appreciate the challenge and what we're really asking them to do and understand why they don't do it. I think one idea for this transition is moving to an electric toothbrush. So if you read the box at the store with the electric toothbrush you're buying, many of them now have a built-in 2-minute timer. So you turn the toothbrush on, it runs for 2 minutes. After 2 minutes, it turns off by itself. Some of them even break it up into 30-second quadrants so you know when to move around. But to me, the most important feature of that electric toothbrush is the 2-minute timer. Having it built in so they don't have to think about it, they don't have to use something different, a timer or a device or whatever it might be. Anything we can do to just make it smoother for them, I think, is a good thing. And then older kids, getting into teenage years, their motivation shifts. So again, are they terribly motivated by cavities, which are a chronic infection that happens over long periods of time? Probably not, but they are motivated by their appearance and their breath and some social realities that happen at older ages. Sometimes leaning into that, I think, can be helpful. And tying it all back to, if your kid's 13 years old and for the past 13 years they've seen mom and dad brush their teeth in the morning and brush their teeth at night, I'd hope that some of that starts to sink in and rub off on the kids. The reality is one day we're not going to be there to nag and bug and get them to brush their teeth, and they do need to find a way at some point to become a little bit more internally motivated. A couple quick notes on kids with sensory issues who just might not like the feeling of the bristles or the taste of the toothpaste or the texture of the toothpaste. And there, I think there's definitely wiggle room to work together and compromise and find solutions that work for everybody. If we think about the toothbrush first, I think their compliance matters more than anything. So is a manual toothbrush better than an electric toothbrush? We get that question a lot. To me, the best toothbrush is the one they're using. And whether that's electric or manual, I think is secondary. But there's kids who that vibration feeling is just sensory overload for them. And for anyone who remembers the first time they ever used an electric toothbrush, it tickles, it feels unique like nothing else, and you can appreciate how that level and type of stimulation for some kids is just too much to handle. And so for those kids, just use a manual toothbrush, because the reality is if they use an electric, they're not actually going to touch all the places they need to touch, versus kids who maybe like the novelty of an electric toothbrush, or they like the feeling of an electric toothbrush, or they benefit from the timer of an electric toothbrush. I think we should be flexible with both of those. If you know that your kid has sensory issues and you wanted to explore an electric toothbrush option, I like just buying the cheap one. That way for $5, they get the feeling, and pretty quickly, if this is something they're interested and want more of, in which case you can always upgrade, versus they put it in their mouth one time and nope, that's it, and you go back to the manual toothbrush. I also think that brushing at a random time of day beats brushing not at all. So looking at some excuses and why kids might not brush their teeth, if we're so rigid in thinking that brushing has to be the last thing that we do before we go to bed, and the end result is that they don't brush their teeth. They got distracted, they're tired, they fall asleep on the couch, whatever it might be. Had they brushed right after dinner, even knowing that they were going to have a snack or whatever afterward, at least we know that their teeth were clean, versus waiting until this specific time and life gets complicated and then they don't brush at all. Brushing before dinner, if the alternative is we forget and we don't brush at all, just brush sometime in the afternoon. So same thing with morning routines. I know my house is busy and hectic in the morning, and if brushing had to be the last thing before they walk out the door, they forgot to do their homework, they didn't pack their lunch, they can't find their shoes, all these things, and next thing you know, they're out the door and they didn't brush their teeth. If we had given them a little bit more flexibility on the timing, brush before breakfast, again, is better than not brushing at all. So if we simplified it to brush in the morning, brush in the afternoon, that might be a little bit more an easier concept for some busy families, and we've certainly fit into that category at times. Last thing, toothpaste. So there's kids out there who don't like the taste, they don't like the texture. If we really break down each component of toothbrushing and what its purpose is and what it does, if we're thinking about the manual disruption of plaque on the teeth, which really is the purpose of toothbrushing, the nylon bristles and the action of sweeping the nylon bristles across the teeth is what cleans the teeth. That's what removes the plaque. What does the toothpaste do? It tastes good, so your breath smells fresh, or it tastes like cookies so that it's appealing to kids, and it has fluoride in it. By using the fluoride toothpaste, you're cleaning the teeth with the bristles, you're getting fluoride on the teeth, your breath smells good. If kids are really struggling with toothpaste, my easiest solution is just run it under some water and brush without toothpaste. So you're going to get all of the cleaning benefit without some of the hesitation due to the taste or the texture of the toothpaste. If a reasonable middle ground, if they'll tolerate, you brush with a plain brush, and then at the end you put a little dab of toothpaste on and you just smear it around. Now you're actually getting all of the benefit. But if you skip the toothpaste altogether, I wouldn't lose sleep over it. So kids are getting exposed to fluoride everywhere where we live. It's in the city drinking water. Everything they eat, everything they drink, they're getting plenty of fluoride exposure. I would much prefer that brushing is more effective because they're more compliant than really dig in on the toothpaste. I hope that's helpful. Overall, toothbrushing is not a one-time event. It's a habit that we build over time. And to me, the most important thing is building those habits so that our kids turn into adults who can't imagine going a day without brushing their teeth. So I hope that's helpful, and I look forward to seeing you soon.